So, y'all are getting a treat today on Too Much Plaque to Handle. We're taking a break from the educational side of things and we're going to the dark side of Reddit. So, I think every few episodes we want to have a little fun. So, we're going to do some crazy Reddit stories and try and figure out what we would do differently and kind of react to what actually happened. So don't forget to hit that subscribe and follow if you want to stay along with us for this journey. We are on YouTube and Spotify. And don't forget to follow us on TikTok, Hannah DMD and Cheyenne RDH. And we're going to find a good story for you all today. So stay tuned.
And this is going to be Reddit reactions on Too Much Plaque to Handle.
I like that Reddit react.
Okay. Are you ready?
Yeah, let's do it.
I was having my wisdom teeth removed. I think I was 18. While the cute assistant was prepping me, we were really hitting it off. I don't know if she was into me, but we were getting along. Enough that when the oral surgeon came in, he abruptly interrupted us and immediately got down to business. No hi, how are you, or nothing. He seemed really upset. We had previously agreed that I'd be put to sleep during the procedure, so he starts giving me gas, and I just closed my eyes and went to sleep. I woke up to him declining my chair all the way back. I asked what we were doing, and he said I fainted. I tried to explain that I was just going to sleep like we agreed. He wasn't having it and said I fainted, and then lectured me about how fainting doesn't make me any less of a man. I was like, yeah, I'm not worried about that. I'm more concerned that I said I wanted to be put to sleep, and you don't seem to believe me. Well, he continued with the procedure while I was wide awake. That was fun. As I was leaving, I heard something that made everything make a lot of sense. The assistant was his daughter, and I think he was pissed we were hitting it off.
Shut up. So he said, you ain't going to sleep, buddy. You're going to feel everything.
It seems like he gave him nitrous. I'm guessing it was nitrous.
Yeah.
That's all you get.
So you get, I said I was going to sedate your ass, but nope, you get nitrous today because you are hitting on my daughter.
Yep.
My gosh, that is hilarious.
Can you imagine? You're just like hitting it off with this guy, and then your dad walks in.
Can you imagine
your
working
dad?
with your dad?
I know, but then your dad's the doctor.
Don't bring family into the office.
No, that was the first mistake.
Yeah, right. This shit happens like this when you bring family into the office. Don't do that. Jeez. Story one. That's funny though.
Also, you should put your patients to sleep if that's what they asked for.
Yeah, typically if they sign a treatment plan and they ask specifically, especially for sedation when you're taking out wisdom teeth, which can be quite the process of drilling and removing bone. And most people want to be asleep for that. To call him out on his manhood too is just
right.
And then he gaslit him. He literally was like gaslighting him and be like, you fainted. What? Oh my god.
Oh, that was so funny.
That's crazy. Now it's on Reddit.
Okay, this one's an orthodontist. We hit all the specialties.
There we go. Yeah, well, so we started with oral surgery, and now let's go to ortho, and we'll go to endo next.
Dr. G, where you at?
Hey, Tina.
My orthodontist was evaluating me for braces. He kept telling me to open and close my mouth, or open my mouth and then close, open and now close. He left his fingers in my mouth when he said close. I didn't feel them in there, so I bit him quite hard.
Yikes.
By accident.
Oops.
He went out and told my mom like I was a bad dog or something. My mom didn't know what to say. She was pretty much like me. You put your fingers in their mouth and told them to close.
It's like play stupid games, you get stupid prizes.
I will say it because I just went back in ortho. I have my trays in. This whole time I've been like, do I have a list?
No.
Well, when they were evaluating me, they're constantly open, close, open, close. I'm like, if you don't move your hand, like
I'm gonna bite you.
Yeah, that's on you. The name of this one though is I got an almost sexual charge from flossing certain teeth.
Okay.
I'm so confused right now.
I'm too. It's appropriate to read.
I know, that's why I'm reading it to see.
Look at her face. Okay, now you gotta read it out loud. Let's go. Face.
I don't I don't know if we can post it, but I'll read it to you.
We do have the explicit like tagline.
I'm so confused.
You look like appalled. Now I want to know.
Okay, this says, I'm really embarrassed to ask this question, but I can't find an answer anywhere, and I'm really curious as to what is going on and why. I hope this is the right spot for me. This is under Ask Reddit. Every time I floss, mainly between my two bottom teeth, my upper canines, and my molars, I get an almost orgasmic sensation in my gums. I can only put so much pressure because it hurts if I do too much, but the sensation is almost indescribable. I'll also pick at my gums sometimes as it sort of does the same thing. I know it's really strange and gross, but it feels amazing. I don't really know how to describe it other than it's similar to that sensation, though that is far more intense, but that's the best example I can describe it with. I
Is
get
she
a
like a
similar sens
masochist or something?
I get a similar sensation when I push the edges of paper under my thumbnails. I've done this since I was maybe 3 or 4 years old. And again, I can do it until a certain point, then it's painful. What the hell is going on with me? I've looked everywhere to try and figure out what causes it and why, but no luck.
I think she might need to go see somebody for an
I'm
evaluation. That's not
that is
normal.
so
That is 100% not normal. What do the comments say? What do the comments say?
well, and it never explained the charge either. I'm like, so why did you almost get a charge?
Clickbait. Yeah, I found one.
I'm searching this, and one of the thing is Reddit confessions. My dental hygienist just turned me on.
Oh, gross.
People are
There's not
so
as much
weird.
funny Reddit shit on here as I thought there was going to be. One of the comments was like, how did you get into dental school if your grammar is that bad? Some foreign schools seriously have no professional standards. And someone said, mate, this is Reddit, not a fucking thesis. I didn't reread it, okay? You don't even know where I go to school. Every school uses English. Damn, savage response.
My lord.
Jeez, that's hilarious.
This is funny. This is a r/dental hygiene. Is hygiene school somewhat fun, or is it just terrible throughout the whole 2 years? Comments. Mostly terrible. No, it's not fun.
I got one. This is the Reddit thread of what is your worst dental story slash experience. Someone commented, when the dentist was working on my teeth, her boob fell out of her shirt and went on my face. She was in her 60s.
Oh my gosh. How does that even happen?
Don't know.
How does that even Oh my
Um,
gosh.
There's another one that said, as I'm bored, let me tell you a story. Went to the dentist when I was around 6, maybe. Me being a kid, I didn't enjoy brushing my teeth. As a result, I didn't brush. I went to the dentist for a checkup and cleaning. They did all that fun stuff. I had 2 cavities. Fast forward to the appointment to get them filled. I wasn't a nervous kid on the outside, so they didn't use nitrous for me. Parents refused it. They injected me with the anesthetic, asked if I was numb. I wasn't, but I said yes. The whole appointment, I felt everything.
Yeah.
Yikes.
See, I tell people, I'm like, please tell me if you're
Mhm.
in pain because I can't read your mind.
This is why kids have trauma.
Yeah, it is.
Yes, these aren't funny. These
Oh,
are kind of sad.
this one's interesting. I think this is an interesting perspective to see from the dental side. Am I the asshole for telling the school nurse she's not a dentist and reporting her?
Okay, it's a good start.
On Monday, my 7-year-old son came home missing his front tooth. It was a bit wiggly, but not ready to be pulled. I asked what happened, and he showed me his baby tooth in a bag and said the nurse pulled it out. I emailed his teacher, and he said my son was wiggling it a lot and asked him if his tooth was about to fall out. My son said he didn't know and was sent to the nurse. He said he was expecting her to just look and to call me. Instead, she pulled it out and my son was not comfortable with it. He said it hurt. I spoke with her today, and she had zero business doing that. She said his tooth was pretty loose, and she was worried he might swallow it. I asked, why didn't you call me then? You're not a dentist, and you caused him pain. She said she's been a school nurse for years. I said, then you should have known better, and you're a disgrace and unprofessional. I did
Ooh.
go to the vice principal, who confirmed that is not within the school nurse's scope to pull teeth, and she should have notified me instead.
Ooh. So the nurse stepped out of her place.
And
That's not within a nurse's scope to be taking out teeth,
not a
especially if
school
it's
nurse.
hurting. Yeah, if it's hurting a kid, if it's really, really loose, a baby tooth is not gonna hurt to come out. It wasn't ready to come out. It might have been loose, but it wasn't quite yet ready to come out, and she ripped it out. Jeez.
That's strange. I don't know. I've just never really thought of anyone other than someone like a dental provider or a parent doing that. I've never even thought about like someone else just ripping a kid's tooth out.
That's really weird.
Okay, so it says fired by my dentist today. Am I the asshole? I thought it was going to be like another dental professional, like working for a dentist. It's a
No, it's a
patient.
patient. Yeah.
It's a patient.
Ooh, this is a good so it's like a dismissed story. Ooh,
Hmm.
okay, let's do it.
It's long. This says the whole story. Apologies if I mess up terminology. I have anxiety and a terrible gag reflex and am unaffected apparently by many weaker analgesics, so I already know I'm high maintenance. However, for several years prior to 2020, I was without a dentist. I found that over a period of time, injected oral pain medication simply stopped working on me. And once I went in for a deep cleaning or root planing or something and had to leave because after 10 shots, and in parentheses, we can't give you any more because we can only administer X amount, I still felt everything as acutely as if there were no shots. A year more of going from dentist to dentist did not fix the situation. So I abandoned hope and just tried to be the best brusher and flosser I could. Why couldn't I just go get a cleaning? I went to half a dozen different dentists trying to reestablish, but they all had started using a new system for dental x-rays that involves this enormous plastic appendage that has to go in your mouth. And I could not accommodate it no matter what I did without violent gag reflex. And no place within an hour's drive still used those old paper bite wings, like the plates, phosphor plates,
Uh-huh.
which were fine. I couldn't do sedation dentistry because until the end of 2019, I didn't have dental insurance that would cover anesthesia. Then I got a new job. Fast forward to last summer, I go to a local branch of a major chain dentist for a cleaning. Now I have insurance to cover whatever I need. After 45 minutes of trying to get pictures of me, the hygienist gets a brilliant idea to use the pediatric size dental x ray, smaller bite plate. It worked. I was so happy I almost cried, but when I went in for my cleaning, the perio was sufficiently advanced that everything they did really hurt, like exposed nerve blackout pain, 10 out of 10, worst pain of my life. They
What?
offered to numb me, but I'll admit I chickened out based on past experience. We rescheduled for a few weeks later and they didn't charge. I came back fully committed to try the numbing. My dental health had gotten to the point where what choice did I have? The dentist was a petite woman with a kind of domineering confidence that was strangely assuring. I can't describe it other than she simply exuded competence. She explained what she was going to do, numb me with a gel, wait a few minutes, numb me with shots, one quadrant at a time. Each quadrant, they were going to root plane, irrigate, and clean. She would give me a series of tiny shots at the base of each tooth. Like I said, I learned later these are called infiltrations. Then they would wait 30 seconds or so and start doing their thing. I'd have to suction at all times if I felt a gag reflex coming on. I was nervous, but I was ready, or at least resigned. It was brilliant. I did not feel a single shot. She must have given me close to 28.
Wait.
It says one for each tooth.
Okay, I bet she did not put there's no way she did, like, a full
28?
cartwheel. There's no way. I bet he's or she, whoever this person is thinking a full shot is just a
Yeah.
poke. There's no way
Mhm.
she did a full cartwheel. Dude, that would,
I
like,
hope
kill me.
not.
Yeah, God, I hope not. Okay, continue.
I did not feel the high-speed irrigation Cavatron, which is what had been so blindingly painful before. It was bliss, and the numbness didn't last long and did not extend to my whole face. It was a miracle, and I was so delighted to have found a clinic and a dentist that actually got me that, I'm going to say effectively, got me that effectively numb. Thanked them, showered them with praise. I walked out with the cleanest teeth I'd had in 7 or 8 years. I came back for my 6th month today. Suffice it to say, the honeymoon is over. First, there was a new dentist. No biggie. It was the same hygienist, and she remembered me. I'm hard to forget. Like I said, I'm high maintenance.
At least you don't.
Then it was revealed that instead of getting infiltrations, the new dentist was going to do a full nerve block. Why are they doing that at your 6th month? They said it was 6 months later.
Yeah. Why are they coming back 6 months later? Why not 3? They should be 3.
Confused. The hygienist, same one again, third time. So I thought that was a good thing. Explained that I'd just be getting 2 shots and the dentist would be targeting the nerve, which would numb all sensation to the midline. So they're doing like an IA. This would be better and I would not feel a thing. I expressed apprehension. I'm kind of a don't fix what isn't broken person, and the infiltrations worked brilliantly before. After going the better part of a decade with no real dental maintenance, I'd finally found something that worked, so why mess with it? She insisted, and I was given no choice. The dentist came in to administer the shots. Look, you only have 2 IAs that you can do. This says the dentist came in to administer the shots, 12 of them.
Wait. Wait, what? Wait, 12? Either this person is extremely anxious and way overestimating what it actually happened, or something weird's going on at
I
this
know,
office.
because it says 12, but before it said they're numbing to the midline, which is an IA.
Yeah.
He started on one quadrant, administered 3, or maybe it was 1 shot, 3 jabs.
I
Now it was
bet
3 shots,
I bet they missed.
all within the same area at slightly different angles. There we go.
Here we go. I bet they
Each,
aspirated too, and I bet they got blood and they had to
yeah,
redirect.
each one lasted 5 to 6 seconds. They were extremely uncomfortable, bordering painful. One did hurt a lot, but they were mostly just high pressure, pain sensation I find hard to describe. After the second quadrant, 2 quadrants times 3 jabs equals 6 shots. That's what they have in here. I turned to the hygienist and asked, I thought you said there were only 2 shots. Her response, oh, sometimes we just have to tell the patient that to make them less anxious. I never do that. I
I don't
tell
do that.
people, I tell people like if we're doing 2 quads SRP, I'm like, so, and depending on how many teeth they have, because like, if they don't have any molars, I do a mental instead of an IA.
Yeah, same.
And so I'm like, oh, today we're going to have to do 4 shots, 5 shots, 6 shots, whatever it is. But I never am like, oh, we're going to do one.
I never tell them a number. I just tell them I'm gonna get you numb. I'm gonna start with the big one, and
Mm-hmm.
then I usually go, I'm gonna give you something a little bit stronger right around the area that we're working in. I'd never give
Mm-hmm.
them a, hey, you're gonna get 5 shots, because there's sometimes I'm poking a couple times around one area with the same
Yeah.
carpool, but
Yeah.
they consider that 3 shots when in reality it's not even a full carpool.
Right.
So I
I,
never
a
tell
lot of
'em.
times, will say your teeth, like different nerves run to different teeth. So I need to numb all of those different nerves.
Yeah, I'll say that too, especially if I block and someone's still not getting numb, especially in like the mandibular posterior linguals. And I need to do like a long buckle up a little bit higher, trying to get that lingual area.
Mm-hmm.
And I'll do extra back in there. You do what you got to
Oh,
do.
there's a lot more.
Let's go.
6 unpleasant shots later, I was numb. Yes, the infiltrations would have been twice as many shots over a longer period of time, but as I explained earlier, and as I explained to her twice, they were shallower, more superficial, and I never felt any of them. It'll be fine, she said. This is better. You won't feel a thing. You'll be all numbed up. And then proceeded to explain to me that they have to take pain management classes, and they were taught that this is better, so this is what they do now. So why did my dentist 6 months ago do it differently? I don't know. That's just something she did, but this is better. It's like what they were told.
Mm-hmm. Sounds like,
After
yeah,
two, yeah, after 2 to 3 minutes, my cheeks got numb and cold. I could even feel it in my eyes. My
cool.
whole face was tingly and cold and slack. It was horrible.
They did a gal
From
gaze.
fumbled out the words, "Wow, I can feel it in my eyes." And the hygienist got angry with me and snapped,
What?
"Get up and look in the mirror." I was confused, so she repeated, "Get up and look in the mirror so you can see that your eyes are fine."
I don't
Mm,
care what it looks like. I'm telling you what it feels like.
yeah.
I've had patients tell me that all the time, like, "Yeah, I feel all in
Yep.
my eyes," especially if I'm doing like an infraorbital or something.
Yeah.
Yeah. I'm like, of course you're gonna feel it all the way up to here.
Yep. So I did. I looked in the mirror. I still don't get what she was trying to get me to see or not see, but I did turn to her and say, "All I'm saying is that with the infiltrations, the numbness didn't take over my whole face. It was local to the area." And all that did was make her repeat with frustration that this way was better. She
It's
started
different.
to,
It's not better.
yeah,
It's different.
she started to do irrigation slash scaling, whatever it's called. It was uncomfortable, but it didn't hurt a lot. I still definitely felt it though. Until she got to a particular place when all of a sudden, all capitals, ouch, major pain. She had to stop. She stood up, put her gear down, asked me pointedly, "What do you want me to do? You want me to get the doctor in here to do the infiltrations? Fine. You want to stop and leave? Fine. Or I can just come back to that area because it takes time for the block to extend over the full area." She was angry now, and I didn't want an angry person in charge of my pain management. So I said, "Okay, just continue. Come back to that teeth later." She did
So this is the same hygienist though that worked on this patient the
the
first
first
time
time.
that she didn't have any issues with.
Hmm.
And now all of a sudden it's like this hygienist has almost flipped a script.
Yeah,
This is so
that's,
bizarre.
I know, I don't like this. More pain, but bearable. Then she got to my upper left, a series of irrigations that were so pain. I'm thinking when they're saying irrigation right now, they're talking about Cavitron.
Cabochon.
So painful, I couldn't take it. It was almost as bad as it would have been had there been no anesthesia at all. I made her stop again. The hygienist said, "I think you need a sedation dentist. I can give you a paper to refer you when we're done here." No, I just need this to be done the way it was done last time, which was fine then. I didn't know why it's not fine now and why no one will listen to me and believe me. She said, "I believe you. I just don't have time for this."
Jeez, that's like a slap in the face.
Mm.
You don't have time to do your job? This is literally your job is to take care of your patients. And you're saying, I
I
don't
was
have time for you. You have time carved out in your schedule for this patient to make time. That's a
nuts.
terrible response. It's so unprofessional.
So they go on to say to the hygienist, "All you had to do was just do it the way I told you. You offered that to me after the fact. Why wasn't it an option before the fact?" She said, "It's more shots. You said you wanted fewer shots." I said, "No. I said I wanted the infiltrations. I told you I didn't feel them at all. They were shallower or whatever. I asked you multiple times not to do the blocks. I told you it wouldn't work." She said, "A sedation dentist is what you need." I told her I've been to local sedation dentists. The one that seemed like a good fit wouldn't take my insurance. There are very few local sedation specialists, and none of them were a match for one reason or another. I tried for 2 years. I already know this. Just next time, do it the other way. When the previous doctor did it and it was done, I almost cried. It was a miracle. It took me the better part of a decade for me to find that. You were the hygienist then, so you remember. Just next time, do it the other way, please." She said, "Look, we deal with dental anxiety here, but this is beyond my scope of practice." Her exact words.
She literally did everything last time. That makes no sense.
No. I said, "What?" They said, "What? Exceeding to a patient's reasonable wishes is beyond your scope of practice?" She said, "I don't think you're hearing me right. I'm referring you out." And that was it. She did a less than ideal job finishing me up, quoting, "I can't clean like I normally would because of XYZ." And then I was discharged. The dentist who always comes back into the room to chat and consult, at least in every dental visit I've had going back for decades, didn't come back. She walked me to the front desk, gave me a list of addresses and phone numbers, and that was it. I may be high maintenance, but we had a treatment plan in place that worked, in which I specifically requested, and they refused, lied to me about what the replacement plan entailed, and then proceeded to chide me for being right that that their pain management strategy was insufficient. And when I complained, they fired me from their practice.
That's a really tough situation, and it's hard because we only get one side of the story.
Mhm.
Because some the patients see it one way, the provider sees it another way.
The weird thing for me is that if it was the same hygienist all the way through, what changed?
That's what I'm saying. Like, what's with the attitude, man?
Yeah. I'm like, what changed with her? Because if it was fine the first time and they saw it was fine the first time, why then did you switch it up and then get mad when what was it was switched to didn't work?
And why say this you're anxious and you're outside my scope, I can't do this when it worked before. That doesn't make any sense.
And they're saying the way it looks, like the way they wrote it, looks like they're saying that the level of their anxiety is beyond their scope of practice. Because the hygienist didn't numb them, the dentist did.
Right.
But the hygienist said, this is beyond my scope.
It's almost like they're just punting. They didn't wanna deal with the
Uh-huh.
patient. And that happens way too often when there are challenging patients and there are patients that have a lot of anxiety and you need to know how to handle them and make them feel comfortable. And there are providers, whether that be a GP, a hygienist, a specialist, that will punt cases because they just don't wanna deal with them. And it sucks for the patient because the patient's like, "I know," in this case, the patient's like, "I know I'm high maintenance, but we had a plan going in, like, our first appointment worked fine. Why are we
Yeah.
changing it to something else that's not working?" And now the patient's, like, freaking out because of that. That's frustrating for the patient. That's a hard one.
That's
That's a hard one.
really I think a lot of that is really strange, and I mean, there are aspects of it, like you say, we only have one side. There are aspects that don't add up, like saying you got 28 shots
That's
in one appointment. I'm like, "Huh?
That's a lot. Yeah.
What?"
That's like a
'Cause
week.
that's yeah. I had an SRP patient one time that I it's like nothing I was doing was getting them numb, but, we were doing blocks, but nothing I was doing was getting them numb, and once I hit, like, because you do the calculations of how many carpules and
Mhm.
if they're an adult and kinda that average range. Once I hit a certain number, I was like, "I cannot give you any more. I can't. I literally cannot." That's crazy.
That is crazy. That's really hard. And because then there's patients out there that have these experiences and then they just don't go back. And then
Mhm.
their disease gets untreated and they have other systemic complications because of it, all because of one bad experience that could have changed it. Like you could have been the light to that person and actually helped
Yeah.
them through. Give them nitrous.
Yeah.
Nitrous is not just an anxiolytic and it's an analgesic. It can help block
Mhm.
pain receptors. Like, give them nitrous. You're trained to do
Mhm.
nitrous, right?
Yeah.
Yeah. So it's like, it's frustrating when you hear cases like this and the poor patients are just like, "I just wanna get my care done, but no one wants to help me." Like, what do you do? How do you do
Mhm.
that? How do you deal with that?
Well, and I think it sucks too because they were so happy that they found what they'd been looking for a decade, and then the next time you go back and it's completely changed.
Yeah, that's hard. There's some holes in the story, and the fact, like, why didn't you go back sooner, and why are they numbing you up that drastically for I was assuming the maintenance
Yeah, that's
appointments,
what I
like a
thought.
maintenance cleaning, not another SRP. Why are we doing blocks for maintenance? So it's like
Yeah.
there's some disconnect somewhere that it's not adding up. But regardless, the patient feels like they've been treated like this, and now that's going to I mean, it's damaging. It's damaging to a patient, and they're not gonna continue to get care, especially if they've had bad experiences or they feel judged. I mean, that hygienist sounds very snobby, to be honest,
Mm.
and too
Oh,
good to take care of a patient like that. I don't know.
I have had patients, I literally am just like thinking of a particular case that had such high, severe anxiety, dental anxiety. And I mean, it's to the point that I walk in the room and they're already like in tears because I
Oh,
mean they're scared, they're embarrassed, they've had a bad experience.
I'm
I can
serious.
think of particular like cases I've had where just me sitting there talking to them for like 20 minutes of like, tell me how, like, what you're dealing with, like, what's your history? Did you have a traumatic experience? Well, like, talk me through that.
Mm.
And just sitting there talking with them, just like person to person, does so much. Then when you just try to like force stuff at people, like them saying, like, oh, they really didn't give me a choice to do nerve blocks. When you start forcing stuff onto patients that are already high anxiety,
Bad idea.
it is not good.
It's a recipe
They're
for disaster.
Yeah, it is not good.
No, that's not gonna end well because
Mm-mm.
then the patient's even more anxious because they feel like they're not being heard, they're not being listened to, and they don't feel like they're in control. And I understand it's the patient should not be in control, but it's also the perception of this is
Mhm.
their health and their treatment. They owe no loyalty to this provider. They owe it to
Right,
themselves. And you've heard me say this before in my lives. The patient, whoever they are, owes it to themselves to get the care that they need with a provider that they trust. And if they're not getting that care at a specific place, then they need to go somewhere else because
right.
you don't owe that provider any loyalty whatsoever. Your loyalty is to yourself to get the care that you need in an
Mhm.
environment that's not condescending, that's actually going to listen to you. And if you have legitimate fears and you need more help to get through those appointments, that's why we do sedation. That's why there's there's other options than IV sedation. There's oral sedation, there's nitrous. Like
Mhm.
give them a Halcyon, give them a Xanax, do something to just get them in the door so that they can actually get the treatment that they need because
Right.
anxiety, dental anxiety, I feel like is one of the number one barriers to care that
Yeah.
people have because people just don't go because they don't want to. Because they're scared. They're scared they're gonna be judged. They're scared that more stuff is gonna be wrong, like go
Yeah.
wrong. And they're scared of what the actual care and treatment is going to entail. And they're scared that it's gonna hurt. And because they've had a bad experience, something has happened in their past that's being triggered because they have an experience that something has happened. And that's why they have this perception when they come into the office of this is how it's going to be, is because it's how it's been before. So we have to figure out what we need to do to overcome that so that the patient can get the care that they need. That's just
Mhm.
it's a really shitty story. It kind of makes me irritated that and
Mhm.
that's one story out of how many millions probably of stories that people just don't write on Reddit that they've just kept
Right.
locked away, and it's hard, and how do you overcome that as a provider?
Right.
That's the challenge. Do you do sedation, oral sedation on your patients? Do you do like like a Xanax or a Halcyon, Ativan, something
The
prior to them
the
coming in?
doctors that I work with do. If like someone, they don't do it for every case, but
Right.
the doctors that I do work with, like if we have a high anxiety case, they will offer
Mhm.
that.
That's good.
Yeah.
Do you try nitrous first, or do you just go straight to oral sedation?
Oh, funny story. Out of all the offices I've worked in since I've been a hygienist, only two have had nitrous.
Really? That's
So
unusual.
So it's not, I don't know why it's just not been as prevalent here, but like in my state, hygienists can start and titrate. Like we can do nitrous start to finish. There are some states where a dentist has to start it and then the
Mhm.
hygienist can monitor it, but we can do it start to finish. But there's only been two offices I've ever worked in that had it
Do you have it now?
in one
And
one of the two
did
that
you
I'm
get
in
the
right now.
certification in hygiene school, or did you get it as a C?
In school. So in my state, I don't know what year they like had passed way back for hygienists to do local and nitrous. It became part of the school curriculum.
Mm,
So now it's not like its own. Now, if you move here from somewhere else and like your state didn't do training for that, then you have to go do some sort of training. But
right.
if you went to school here, it's like within your education, so it's not a separate certification.
Gotcha. Okay. That's good. I mean, I think hygienists should be able to utilize that because that's a tool. That's a
Mm,
tool to give patients some sort of relief, anxiety
mhm,
relief. And I use nitrous not that often because I also do IV sedation. So there's really nothing better than IV sedation that knocks them out. And
mhm.
they're very comfortable with the drugs that I give
Right,
them.
right,
A little bit different than nitrous. But for the patients who are like, I don't want to bring a driver, or I can't bring a driver, I'm driving too
right.
far. That's when we start talking about, okay, well, we could try nitrous and see if you're comfortable with that because it does, like I said, it has an analgesic effect.
On the topic of IV sedation, I've found a funny story.
Oh, okay.
Since you do IV sedation,
Mhm.
I'm curious to see.
What my thoughts are.
Yeah, you're gonna laugh at the name. I like
Uh-oh.
the tag.
Uh-huh.
Am I the asshole for losing it on my dentist for shaving my mustache off while sedated?
Okay, my immediate reaction is if they shaved his mustache, it means he needed an airway. Like, they needed to, like, bag mask him, so he
Oh,
stopped breathing, and if you can't get a seal when you're bagging,
right?
they're gonna shave the mustache, so my just
Huh.
immediately going to he stopped breathing in the middle of that procedure, and they had to bag him. Okay, so let's read on. This is gonna be a good one.
This says, I went to the dentist the first time with this particular dentist just to check up with him before this. The other day for some pretty extensive work. I'm terrified of the dentist, so I decided to go with IV sedation. I wake up to find that my mustache was gone. It's pretty thick, thank you. I got really upset with the dentist and yelled for a bit. He apologized, but said that because he had to work at an angle from the top of my face, his tools kept getting caught in the hair, making
Oh, it
it
must be
difficult to
wrong.
work.
Oh, no.
He said he thought this would be preferable to waking me up and rescheduling so I could shave. I was still pretty mad. He told me he keeps disposal razors on hand for this reason. This seems kind of suspicious to me. After I got home, I reviewed all the paperwork for the IV sedation, and there was nothing in the paperwork about being clean shaven or advising they might shave you.
Where is this in the consent form that says,
Right.
"By the way, we carry disposable razors. You might wake up without facial hair." I have
Oh,
never heard that before.
and they said, honestly, I actually probably would prefer to be shaved while sedated rather than rescheduling, but very mixed feelings on this. I
Okay,
can't imagine.
it must have been like a long handlebar mustache, and it was just I mean,
That
yeah,
is
hair gets in the
strange.
way. Suturing with facial hair is hard because sometimes I'll grab hair instead of the suture.
There's a comment from I think they're tagged as a surgeon, but like a GI surgeon. They said he might have a thing for shaving sedated people. In any case, you could find the state board and file a complaint. At the very least, they can tell him he needs to make it explicit in his paperwork, his requirements for facial hair.
Never heard that. Now I wanna go ask some of our oral surgery residents, be like, "Do you guys keep razors in here for facial hair?"
Interesting. There's a comment too that says, I think there are laws against this. I can't remember exactly what the law is, but in my country, it's the healthcare worker's duty to inform the patient about the procedure and all that may be involved. You did not give them consent to shave, and they should have asked in advance with the possibility of needing to.
Which I agree. I agree. It should have been
Mhm.
in the consent form.
Somebody said, what else did he do while you were asleep?
That's so bizarre. I've never heard that. That's wild, man.
Like, that's so funny, though. It's like, I woke up and my mustache was gone.
I just like, this is going, I don't one of 2 ways. So
Oh
I was
my
wrong.
gosh.
I was way off,
Unless if they just didn't tell him that they actually had to do that.
which I guess is a possibility. I guess, yeah, that is so funny.
Well, I hope y'all enjoyed our random Reddit stories.
If you want to hear more Reddit stories, we'll be dropping them every now and then. We'll have some fun, go from educational to crazy Reddit stories. So just make sure you hit that subscribe and follow button. Follow us on TikTok, Hannah DMD and Cheyenne RDH. We are on YouTube and Spotify. So catch us on the
We're,
next one. We'll be doing some deep dive into perio. Oh, boy.
we're going to deep dive oral systemic link.
There we go. Oral systemic link. Have a good night, everybody.
Peace out, Girl Scout.
It's our new tagline.